Hi everyone, hope you're having a great month. Today I want to talk about legitimate treatments in hair restoration. We have many treatments today. Back in the day when I started losing my hair, there was Rogaine that was being experimented with, and I was one of the subjects as a college student. Well, now we have Rogaine foam at 5%. We have Propecia, which is Finasteride. It's an oral medication, came out in mid to late 90s. And we have low-level lasers, which are laser lights, that came out in around 2000. We have platelet-rich plasma. Now, platelet-rich plasma is considered experimental. However, most of us have been using it since 2009. It's kind of a no-brainer to use with a procedure like this. It's great for healing, helps the grafts growing a little quicker, helps with even regrowth in the crown area, helps patients stop losing hair. So we do use that with and without surgery. And of course, we have hair transplant surgery via the strip method or via follicular unit excision. We use the robot. So these are legitimate treatments. Now, Rogaine, how does that work? Well, it works on the circulation as far as we know on the scalp. When used alone, I don't find it's that helpful, although some patients it could considerably help. Now, the next treatment is Finasteride or Propecia. That's the oral medication taken by mouth. Now that one is very effective in helping you stop losing your hair. However, it takes about 6 months to stop hair loss and could take up to a year to see some regrowth in the crown mostly, maybe the mid-scalp area. When used with Rogaine, they seem to work better together, synergistically. Low-level lasers, those work like the sun on the lawn. They work on the cell cycle of the hair follicle. They help to thicken hairs, to regrow hairs, to stop hair loss in all those ways. They also work great with wound healing and hair transplant surgery. They're low-level lasers. They're not hot lasers. They're like laser lights, and they're easy to use. You use them at home 3 times a week. You could buy it in a comb or in a hat or in a helmet, and they're pretty effective, especially when used with Rogaine and Propecia. Platelet-rich plasma, or better known as PRP, is simply a procedure where you come in, we draw a little blood, we spin it down, and we collect the platelet layer. We concentrate it. Platelets release growth factors and contain circulating stem cells, and these are the cells that repair, rebuild, help make your hair a little thicker, help stop hair loss, may help regrow hair, certainly help with wound healing. So we use all of these here at my clinic. And of course, hair transplant surgery at my office. As most of you are aware, we do the strip method. I have a laser edge closure that I've created and still use to minimize the linear scar. And for those of you who want to wear your hair super short, we of course have the ARTIST robotic system here that leaves no linear scars. So that's legitimate treatments in a nutshell. Hope you're having a great month. See you next time.